Thanks for staying with JoyNews Desk. The Lara Municipal Hospital is in dire need of medical equipment. The hospital, which was established some 90 years ago, now has its structure worn out and dilapidated. And medical equipment are inadequate, forcing them to refer cases outside the facility. The hospital has no neonatal intensive care units and has one incubator for the several premature babies born at the facility. The medical ward of the hospital is admitting both male and females who share one bathroom and toilet. Ahead of the launch of the 90th anniversary celebration of the hospital, JoyNews' Upper West correspondent report on the successes and challenges faced by the hospital, which government and other benevolent organizations need to turn the fortune of the hospital for the better.
Established some 90 years ago, the Lara Hospital's sole duty was to address the issues of preventable diseases which were prevalent during the colonial era. The first medical doctor posted to the area was Dr. Smith. Paramount Chief of the Lara traditional area, Napo Wele Kabo III, who was born 21 years after the hospital was established, says the hospital changed its focus to curative diseases 10 years after its establishment.
By extrapolation, we believe that the early hospital, the focus was more on prevention than the curative aspects, because at that time, the whole of the Northwest, and indeed the whole North, was devastated by preventable diseases like sleeping sickness, mumps, dysentery, malaria, and others, mumps, yaws. And so it was a good idea to focus on this aspect of prevention. That is, and therefore, their major focus at that time was to educate our people and try to see how they can eliminate these devastating diseases.
Close to 40 years ago, Zeka Yiriyele took over the reins of the administration of the hospital, coupled with his duties as a medical assistant. He tells me how life was when he took charge of the hospital in 1978.
Challenges were water and light. I had to, from our own resources, connect the hospital with water, and also pressured the water supply department to help supply the hospital with water to make it functional. Else we were using service water to wash our hands to provide services.
The situation at the hospital, however, has changed today. It is now a 110-bed hospital with a little over 250 staff, serving a projected population of 64,000. The hospital is the main referral point for 4 health centers, 1 polyclinic, and 18 CHIPS compounds. Yet, the equipment to do the work are either obsolete or not adequate. Dr. Justin Dakura is the medical superintendent of the hospital.
If we are to have about 5 cesarean sections in a day, the equipment that we need are not really adequate. If we have in succession about 5, that means that we have to re-sterilize, use, pack, sterilize, use. So we don't have enough of the equipment that we need for maternal care and then some of the other major operations that we can easily carry out here. So because of that, some of the cases have to actually be referred.
This small room I am currently in is supposed to serve as the neonatal intensive care unit of the hospital, because I'm told that they don't have it. And so, but they are supposed to take care of premature babies and other babies that are born and they are not well. But just closer to me, you can see that there's an incubator, and this incubator takes care of 1 or 2, but they have some challenges. Doris B. Negre is Lara Municipal Health Director, Public Health Nurse.
When we have just one incubator, definitely there's going to be cross-infection, because the babies are not coming from the same family. They are coming from different families, and they may have other disease conditions. So because of that, putting them together in one incubator is actually not always very helpful at all. And even they need to have a very spacious place where they can have a lot of fresh air. With their mothers in there, it is difficult because at this time, like these children, they are very fragile and they need a lot of care. They need cleanliness. They need to have a lot of personal hygiene so that the whole place will be sterile to be able to take care of such children. This year, like that, we have got about 5 neonates dying. Last year, there were 9. But at least with the efforts that we have put, even though it's not enough, it has been reduced at least to 3, 2016. But this year again, last year, 2017, it went up again to 5.
This is the medical records department of the hospital. This is where folders of patients are kept. At my back, you can see huge files packed on the shelves. Administrator of the hospital, Prosper M. Lana, tells me the inconveniences they go through to search for folders to patients.
The place is quite small, and over the years, it's getting filled up. And the challenge now is where to store them. So usually, the staff in this particular department have issues with retrieval of folders, timely retrieval of folders. There are instances where folders get missing and all of that. So the way out for now is for us to go electronic. So when we have a computerized or a networked system where patient details are